Hello everyone, I'm Dr. Angela Mattke and you are watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. Twice per month I host this show where we discuss common pediatric health topics with experts from Mayo Clinic Children's Center in Rochester, Minnesota. April is Autism Awareness Month. Autism Spectrum Disorder is also the focus of our discussion today. Autism is one of the fastest growing developmental disorders in the United States. To help us understand more about this topic, Dr. Flora Howie, a developmental and behavioral pediatrician, is joining us today. For over 20 years, Dr. Howie's clinical focus has been to identify and address the unique needs of children and adolescents with autism. In recognition of her work, Dr. Howie has received many awards and honors. In addition to her clinical and research activities, Dr. Howie is active in education and provides mentorship to many medical residents. We are honored to have her joining us today. If you would like to join our conversation, please post your questions or comments under the Facebook Live video stream or on the Mayo Clinic Connect website, and we will try to answer them during our live broadcasts. We look forward to getting to some of the questions that have already been sent in. So, Dr. Howie, thank you so much for joining us here today.
Thank you for inviting me.
This is a really important topic that I think that we need to continue to spread more awareness about.
Mm-hmm.
So let's start by having you describe to us what actually is autism.
Autism is a neurodevelopmental disorder that has a genetic pattern to it. What that means is that there's something that goes on in the brain, some connections that are not working well, and it is something that is genetic, meaning it can be inherited, or there can be something in a person's DNA, in their genetic makeup, that has changed, a part is deleted or substituted to cause this problem. The other side of the definition is that we're looking at a disorder where you have social communication problems, and then you also have restricted repetitive behavior. Some people call it the RRBs.
Okay.
And you can have difficulty with social communication in terms of not being interested in relating to people, having difficulty communicating using the proper words, or reading someone's body language, or transmitting your own body language. So for instance, you're shaking your head, good eye contact, right. That's all part of that social communication. And persons on the autism spectrum have difficulty with that.
Okay. Sorry, you were going to say?
In terms of the restricted repetitive behaviors, you can have problems with too much sensitivity to sensory input. You can have repetitive movements, repetitive speech, and you can have very restricted interests, only being interested in dinosaurs, or only being interested in something in particular like Thomas the Tank Engine or commemorative stamps, very restricted.
Okay, you mentioned it's a neurodevelopmental disorder, meaning that some of these symptoms and signs of it may be developing as the child gets older. What are some of the signs or red flag symptoms that would really want to make sure that you're bringing your child in for an evaluation if you're concerned?
The red flags that parents should really be aware of: by 12 months, a child should be babbling, should be using a gesture like pointing. By 16 months, they should have a couple of words. By 24 months, they should be able to put two words together. That's sort of that magic age when you have about 50 words in your vocabulary, and you can say something like want juice, as long as it's not echolalic. If you're repeating someone else's speech, that's not a two-word sentence. And if there's any loss of any language or any social skills at any age, those are red flags.
Okay. We have a nice diagram that we can show later for families if they want to try and remember what those red flag symptoms would be. So when are these signs going to start to become present? When would parents first notice them?
Many parents notice the signs around 18 months of age with regression or loss of language, typically language skills. Parents have been described in studies, however, to see signs even earlier.
Okay.
And so you can have a 1-year-old child who is holding an object or a toy and moving it in a very repetitive, almost stereotyped pattern, and not actually playing with it. You can have a child who's 12 months old who isn't following when the parent points to look at where they're pointing. So there are some signs that you can see even earlier.
Okay. And as pediatricians or medical providers, that are providing primary care for children, there's been some good guidelines about how we can help screen and identify kids that may be struggling with some of these social emotional behaviors and development early on. When would you recommend that we do this screening?
The American Academy of Pediatrics recommends screening at 18 and 24 months.
Okay.
So for instance, if you have a child who's screened with a tool, the MCHAT, the Modified Checklist for Autism in Toddlers, is one of the most popular. If they're screened at 18 months and then you see them at 24 months, you screen them again. If they're screened at 20 months and then the next time you see them they're 30 months old, well, that 20-month-old screen is it. But 24 months is that point at which usually if there's going to be signs of autism, you've seen it by then.
And that's one of the values of having a primary care provider and making sure that you're going in for regular well child visits, in addition to get their immunizations and check other parts of their health, but really to follow that developmental skill progression and making sure everything is going as it should.
Absolutely.
And we're doing this for all children, right? Not just identifying certain children?
Absolutely, for all children.
Okay. All right. So if families have concerns, how should they raise these concerns to their provider?
They can tell their provider that I'm worried that Susie or Johnny is not speaking yet, or they're not making eye contact with me, or they're not playing with toys. So any concern, there is no concern that you cannot bring up with your provider.
Absolutely. So if the provider is also concerned, what does the evaluation process look like? Who would they be referred to, and who's really involved in that process?
With the evaluation process, we have a team. And the developmental pediatrician is typically on the team, psychologist. We have speech therapist, occupational therapist. Some teams have a behavior analyst, some don't. Some teams include a physical therapist. And the audiologist is very important. If there's any concern about speech or language or development, we want to make sure a child can hear. That team does an overall evaluation to see where a child is with their thinking skills, or they'll call it cognitive level. They want to see where they are with their speech and language. And they look to see if after the evaluation there is that pattern that we see in autism. One of the markers is if you have a child whose intellectual functioning is up here, but their social skills are here, there's that gap that's telling us there's that problem with social communication. And that's the hallmark, one of the hallmarks of autism.
Okay. So we have some great audience questions. Are there any specific tests that you use in this process to identify? Is there a blood test that can say yes or no, or what other kind of evaluation processes are you using?
I wish there were a blood test. There isn't.
Yeah.
It's a process where we watch the child's behavior. We have the parent fill out questionnaires. We do direct testing of the child to see where they are with their thinking. So just to throw out a name of a test, we may do something called the Bailey Scales of Infant Development. And that tells us how a toddler is thinking things through in their world and problem solving. There's another test specifically for autism, and the two gold standards are the Autism Diagnostic Observation Schedule, and the other is the Autism Diagnostic Interview Revised. The interview, it's an 88-page document.
Wow.
And it takes at least an hour to administer, so it's typically used in research.
Okay.
Another excellent tool is the Childhood Autism Rating Scale. That plus an autism observation schedule, those are very good to use together.
Okay.
And there are some screeners that are helpful as well.
Okay. So the evaluation, this is the evaluation you're talking about in the medical setting that would take place. There's probably also evaluations that are going to be happening in the educational setting. What does that evaluation process look like?
They're looking to see if a child is eligible for services in the school system. And so they're looking at eligibility criteria, which people and parents should know is different from the medical diagnosis. So you may have an eligibility through the school, and their evaluation is very similar. They don't have the medical component, because in the medical component we're looking for other things like genetic disorders, seizures, problems with the stomach, problems with sleep. In the school, they're not doing that, but they're looking at where they are with their intellectual functioning or other things like speech and language.
Okay. We have an audience question about undergoing that evaluation. through the school district and looking at IEPs. Can you explain a little bit how this can be helpful with a child who does have autism and how they qualify for an IEP?
Absolutely. The IEP, or Individualized Education Program, it's a legal document, and the school does an evaluation. They determine whether or not a child is eligible for autism services, and they would give that eligibility or primary disability of autism. And if there's anything else like speech or language delay, that would be on the document as well. And it's pretty much a roadmap saying your child needs, let's say, speech therapy, how many times a month or how many times a week. Your child needs social skills training. Your child needs occupational therapy. And from the school system's point of view, they're looking to see, is it educationally relevant? So a child may not be able to do certain things with their hands, but if it's not something that's relevant to their education, the school may not give that service, the occupational therapy to help.
Okay. So let's talk a little bit more about some of the services that maybe we would recommend in the medical setting, in addition to maybe what they're already qualifying for in the educational setting. What do those look like?
We would evaluate and look for whether or not a child needs similar things: occupational therapy, speech therapy, physical therapy. Also in the medical realm, we're always very mindful of looking if there's a genetic problem. And so we will typically send a child to a geneticist.
Okay.
They will often do a test called a microarray analysis or DNA testing for Fragile X, or other tests as well. If we have any concern about seizures, then we would send a child to neurology. Problems with sleep, which is fairly common in autism. We may involve sleep medicine, but of course we also work with the family directly on those issues, and feeding issues as well.
Yeah.
So those are some other things that we would do in the medical realm.
Okay. GI concerns are also another common a common concern that children with autism may experience. Are they involved with gastroenterology at times, or how are those symptoms managed?
Yes, they can be.
Okay.
One of the things that we also find is feeding therapy can be helpful. Children on the autism spectrum, remember those RRBs, the restricted repetitive interests, that can also spill over into food. So I've had children who only want to eat 5 things. And we worry about, are they getting the right nutrition? And they only chew things that are textured or crunchy, and they don't want soft foods. And so the diet becomes very restricted. So feeding therapy can help with that.
Okay.
And in terms of gastroenterology, children can have problems with constipation, stomach pains, and we want to rule out if there's anything medical, organic that needs to be treated.
Absolutely. What does the feeding therapy look like? Is it a multidisciplinary program, or is it more kind of one-on-one with an occupational therapist?
It would be more one-on-one with an occupational therapist. Okay. Some centers, speech therapists do the feeding therapy, and here we have occupational therapy do most of that.
Okay. Another audience question that we've had is sometimes children are being diagnosed later in school age or even early teenage years. And why is that diagnosis, making that diagnosis of autism spectrum disorder so challenging?
There are many things that can masquerade as autism. In fact, there was an article that showed that many children are diagnosed with ADHD prior to getting the diagnosis of autism, or an anxiety disorder prior to getting the diagnosis of autism. And if children have a milder form, it can be quite subtle, because what we're looking for is, do they get jokes? Do they get sarcasm? Are they always looking at me when I talk to them? Are they looking this way when we're trying to have a conversation? Those are things that you may not pick up for a 15-minute office visit, which makes perfect sense if the parent is not aware of things like red flags or signs, and they don't tell you. So the milder forms of autism are primarily social communication problems, which can be subtle.
So some families are sometimes a little bit worried about going down the pathway of through the evaluation from autism. They're worried about their child be given that diagnosis, or I sometimes hear them say the terms being labeled with that diagnosis, especially if they're quite subtle symptoms of it, or very high functioning in their day-to-day lives. What would be the benefit of really making sure that we know what is causing their symptoms?
The benefit is the child having the ability to put a name to what they have can be very powerful, and it can also help them address the problems they've been having. So I have worked with many adolescents, teenagers who will say, I don't have friends, or I didn't get that joke, or I've had 15-year-olds and I'll say it's raining cats and dogs. That's one of my favorite questions, and they'll take me literally. They have a really hard time, kids whispering by the lockers or sarcasm or cliques at school. And so they can be socially isolated. And if they become aware, oh, I have this thing called autism. Oh, I can work on it. Oh, I can go to a social skills group. I can figure out how to work with this. And also, I'm okay, you know? I am unique, and this makes me a person that has special qualities. I have a video I love to show of a child who is great at basketball, and he has autism, and he won the game for his team because he's so focused that he was able to, you know, just do a wonderful job. So, you know, there are many gifts, and a child should know that this is what it is. If this child doesn't understand what I'm saying, maybe there's another way to say it. There's a way through this.
Absolutely. There's a specific type of interventions or behavioral therapy that's used in autism. Can you talk a little bit more about those and when is most useful to be using those types of therapies?
There's a whole world called ABA, or Applied Behavior Analysis. And what it is molding behavior, and you're analyzing it first so you know what you want to do. So for instance, if you have a child who cries every time you walk into a particular store, you want to figure out what's going on. So ABA providers talk about the ABCs. The A is the antecedent, what's causing the behavior. The B is the behavior. What does it look like? What does the child do when they're upset? Do they fall out on the floor? Do they cry? Do they run away? And then the C is the consequence, which is probably the most important. What's the payoff? Why is this child doing this? To get away from something? To get attention? So they do a functional behavior assessment, and they're analyzing what's causing the behavior. Then they come up with a behavior support plan, which is, okay, this child has difficulty when they are challenged by this math worksheet. So what we can do is find ways to prevent the behavior. Maybe give easy math problems that you know they'll be successful with, and then slip in some more challenging ones, or verbally prepare them before math. There's a list of things that can be done using motivators to help get them through it. But you create this entire plan, and that helps the child get through whatever the issue is. It can also help to teach skills.
Absolutely. And so this, I imagine, can be used in young children, preschool age children, but also can be applied later on school age. Is that correct?
Absolutely.
Okay.
Yeah.
And are schools using this as well as other kind of private therapists, private therapy groups?
Yes.
Okay.
Yes.
All right. So where would families kind of seek out these kind of therapists and get connected with that?
There are providers in the community. There are some schools that we have here in Rochester that primarily have ABA providers. Within the school system, they will do a functional behavior assessment, create a behavior support plan. And so that's another resource as well. Early intervention providers also have teachers, providers that know ABA principles. So that's another good one. And so those are some sources.
And so this has been studied and been shown to be evidence-based to help children.
Absolutely.
Right.
Many years of research behind ABA.
Okay. So it sounds like there's a lot, it's a very multidisciplinary approach to helping children who have symptoms of autism, right?
Yes.
And it's going to be very individualized to identify the needs of the child. Is
Absolutely.
that correct? Okay. There's a lot of other kind of alternative therapies that are out there when families are looking for anything to help their child. Can we talk about some of those alternative therapies and whether they're safe or they have actual evidence behind being able to help their child?
Yes, and I'd like to say that I understand when families look for alternatives because we don't specifically know what causes autism. And so families, I think, in many cases can be vulnerable to things that are out there. And so, for instance, hyperbaric oxygen chambers, those we find do not cure autism. Actually, I know of a family that bought one had it in their home, and then they sold it on eBay for half price, and they're quite expensive.
Yeah, I imagine.
There are vitamin supplements that some families use. There was one study for omega-3 showing that it may have a subtle effect on attention in children in terms of improving attention. Not something to use in and of itself for therapy, but omega-3 is something that has some evidence. But other things like chelation therapy, there have actually been some deaths from chelation therapy. And if you also give chelation, you can leach out other metals in the body that you actually need. There are other things. If you surf the internet, you'll find many things. And, I feel for families, it's overwhelming. If you click in autism in Google, you get, last time I did it, 10 million hits in less than a second.
Wow.
And so it can be overwhelming. And so I think what's judicious is to speak with your primary provider and professionals that can give you advice on what's safe and what's not safe.
Absolutely. We have an audience question about the use of oxytocin. Can you talk a little bit about that?
Yes, there was a study that was done looking at whether or not it can increase social interaction, socialization. And we have not found that it's something that we can recommend as a therapy for autism.
Absolutely. Other things that families sometimes look at is their child's diets. And there's some information out there that families will find about certain diets being helpful. Can you talk a little bit about that? Are they helpful? Are they safe?
The diets, for the most part, if you have a nutritionist involved, if you're very careful, can be safe in terms of that portion of it. However, if you don't have a specific allergy, for instance, you're on a diet where you eliminate dairy, and you don't truly have an allergy to dairy products, then you're not going to see a change or an improvement. Some children truly do have a sensitivity or an allergy. It's not as common as the media may seem to advertise that it could be, but it does happen. And in that case, if your child's allergic and it's eliminated, you can see improvement in behavior. But in terms of overall treatment of autism, eliminating things like gluten or casein, if you don't have a sensitivity or an allergy, is not going to cure the autism.
Okay. Another kind of common misconception or about autism is that there may be some association to vaccines. And this has been disproved and not found to be connected in any way. But let's have you talk a little bit more about that and what kind of research has been done to look at this issue specifically.
Yes. Well, a lot of what we are living with today is based on a study with a very small population done by Dr. Wakefield in England. And actually the parents in the study felt that vaccines had caused their child's autism. It was a small population, and some of the funding actually came from lawyers, and they found that there may be an association. Studies have been done since then, many, many studies, and they have not found that. It has not been duplicated. Dr. Wakefield actually lost his license in England, and I believe he came here to America. But we do not have evidence that the vaccines cause autism. In fact, in Japan, a few decades ago, they eliminated the MMR vaccine, and the prevalence of autism continued to rise. And we have found that children not getting immunized are open to many serious illnesses. In fact, the Journal of the American Medical Association in 2016 put out a statement that we have no evidence behind autism being caused by vaccines. We need to get our children immunized. It's very important.
Absolutely. It's important for them, but it's also important for everyone else around them, and trying to prevent those potentially deadly diseases from coming back.
Absolutely. Absolutely.
A couple more kind of myths about autism. Let's kind of go through those. Is there a cure for it?
No, our understanding of autism is that it is lifelong. There are some studies, and this is very rare, so out of 100 people, we may have a tiny cohort or a group where the symptoms seem to disappear. So I do that test I was talking about earlier, the Autism Diagnostic Observation Schedule, and they don't score on the spectrum. And so we are not finding that the scores on the tests that we use are showing autism. Close family members, however, may find, oh, they're a little quirky, they don't get all the jokes, the kind of the absent-minded professor, and they do okay, but you still see some of those remnants of the autism. So that's a small percentage where it may seem to not register on the tests that we do.
Okay. Let's finish up with kind of one last question. And this is about children with autism spectrum disorder. We mentioned earlier have some other things that they may have symptoms with or associations with. Can we talk a little bit more about, you mentioned ADHD, are there other things as well?
Yes. ADHD is pretty high among children with autism. And decades ago, I'm pretty old, so
No, you're not.
I was there back then when the recommendation was, well, if they have autism and they're hyperactive, they don't have ADHD. But over the years, we have found that that's not true.
Yeah, they're not mutually exclusive, right?
Exactly.
Yeah.
And so many children that have hyperactivity or inattention that we treat with medication for that benefit.
Okay.
And they also do have autism. Another is anxiety. We have found, I had a work readiness program I used to do for children on the autism spectrum. And we found that teens that were higher functioning actually seemed to have more anxiety in their move toward making that transition into the workplace, dealing with all of the unspoken signals, the checking in with your supervisor, the conversations with coworkers caused a lot of anxiety. And so we see that in that setting with the higher functioning children, but we also do see it across the spectrum, more anxiety.
Okay. So anxiety and ADHD are kind of more common psychiatric conditions that are associated with them. Okay.
And we can also see behavior problems, tantrums, disruptive behaviors.
Okay. What about intellectual disability? Do you see that being associated with autism?
Yes.
Okay.
We used to think it was more, but now we're finding, now we're better able to diagnose autism. We're finding children that are higher functioning that have intellect within the average normal range, and they're on the spectrum. So now we're adding that population of children to the overall pool, and so we're finding that the numbers with intellectual disabilities, when you look overall, the proportions have gotten smaller.
Okay. And I understand that there is a new prevalence study that's going to be coming out about how frequently we're seeing autism in children in the United States.
Yes.
Who will be doing that? When will that evidence be coming out?
The Autism and Developmental Disabilities Monitoring Network in the CDC, they do a study, a prevalence study every few years. The last one, we had a prevalence of 1 in 68, and that was published in 2016.
Okay.
And so we're due for the every other year study coming out. And so I've been watching to see what that will be.
Yeah, so stay tuned for that new information. Lastly, let's finish up by telling families about some resources if they're not already aware of them. What do you recommend that families go to for guidance, for support, for resources to help them and their family?
One of the things I think that's very important is for the family to have social supports. Okay. And so not necessarily a professional to give them numbers and things, but someone maybe to help with the other children or to give respite to the family. So other family members and social supports are important. And the providers, you can, some families talk a lot with their occupational therapist about what's going on personally and get support there. There are some websites that are good. Websites that have .edu or .org at the end, those are usually better. Websites to be cautious of are ones that have, miracle cures, or they don't have a .gov or .org or .edu at the end. The American Academy of Pediatrics has healthykids.org. That's a great website. Autism Speaks. They have lots of resources on their websites. There's the first 100 days. It's a toolkit that can help families that have been newly diagnosed sort of navigate what's going on. I have found that to be very helpful for families.
Thank you. This has been Fantastic. Thanks for sharing all your expertise and knowledge.
My pleasure.
Thank you, everyone who joined us. That's all the time we do have today. Join us for the next Ask the Mayo Mom, which will be on April 19th at 10 or 11 a.m. Central Standard Time. Our guest will be Dr. Rodrigo Ruano, who is a renowned maternal fetal surgeon and a leader in the area of fetal surgery. He will join us along with Dr. Sama Saeed, who is a pediatric cardiologist, and we'll discuss fetal surgery interventions. Thank you, everyone who watched and sent in questions, and have a wonderful day.